All right, here we go. It is Spinal Anatomy. It is, what is it, Tuesday? It is the summer. No, it's not the summer. It is the fall of 2020. You know what? All right, this is, I think, one of the pictures from your lab today. I think that's the third picture. This is a PA view of axis C2. I also just went over this in lab with some of you. But I think we know most of these parts. This is the spinous process. It's a bifid spinous process. And then kind of going into the plane of the page, we have the lamina, which would be right about in this region. Then we have the pedicle, inferior articular processes, there's the other one. The facet would be on the other side, right? You can't see the facet from here, but the facet for the inferior articular process would be on the other side. Transverse process, pedicles, we did those. Remember, the pedicles connect the vertebral arch to the body. They also make up the roof and floor of the neuroforamen, which are important. And we have the facet of the superior articular process, facet of the inferior articular process. Body is all this. And then this, of course, is the dens. Number one would be the dens, but you can see on this one we have three little facets here. That's called the facet for the transverse ligament of Atlas. And this is the alar facet, A-L-A-R. Kind of looks like a little human, like, crying out. There's his nose and his mouth and his two eyes, but those are for the alar ligament, facets for the alar ligament. Or you could say the alar facets of the dens is another way to say that. Right? So there's for you to practice. All right, let's talk about this vertebral artery. I don't think we've talked about this before. You do know this from Gross 1, right? You've had this already. So there's a subclavian artery, and we have a branch going in to the meat of the neck, and it goes into the spine here. Specifically, it skips, for whatever weird reason, it skips C7. So that's C7. And it goes in at C6 instead. This is always a great board type question. Anything time there's weirdness like this. The vertebral vein, there's usually two of them. It goes in at C7. So why the vertebral artery skips C7 is a mystery. But once it dives in this hole, it's no longer part 1, or it's called V1 is from the subclavian artery. Once it goes in this transverse foramen, it becomes V2. V2 has a pretty easy job. It goes straight up. Once it comes out of C2, this is C2, once it comes out of here, it gets another name called V3. You guys may have heard, sometimes, super rarely, but chiropractic manipulation is considered a, quote, precipitating event, close quote, when it comes to dissecting aneurysms in the vertebral artery and paralysis and death. It occurs a couple times a year. Usually this crazy V3 is the part that the dissecting aneurysm will occur in. And we'll talk about that a lot more in 5th quarter. But basically, I think you've studied blood vessels enough to know there's a tunica adventitia, tunica media, tunica intima, and the tunica intima can split. The blood can rip through the tunica intima, and it can get stuck in the tunica media, and it can split down the wall and travel down the wall. And that's called a dissecting aneurysm. And the trouble with that is it fills up with blood clots, and then it usually does something called double barreling, where it breaks back into the main stream. And when it double barrels, it releases all those blood clots, and down they go, or up they go into the noodle. And it's not a good thing. You can get strokes from cerebellar infarct, or it could get into the Circle of Willis and cause a massive stroke. All sorts of trouble can happen, and this pesky V3 is usually the culprit. And once you go into the dura, that becomes V4. So V4 is actually an interthecal part of the vertebral artery, and then there's the basilar artery there. All right, foramen magnum is this hole in the bottom of the skull. There's a real skull. Should show you these right here. These are the occipital condyles. Those are super important. They connect with C1's supraarticular processes to make the atlanto-occipital joint. So those are really important. Okay, great board question. Remember these holes. You're going to study these holes a lot next quarter in Gross 2 anatomy. All these nooks and crannies have nerves coming out. Inferior orbital foramen is right here. Inferior orbital nerve comes out of there and some blood vessels. And they get more complicated when you get inside, but authors love, or test question writers love to ask what comes out of these holes. So what comes out of the foramen magnum? Well, it transmits, meaning which structure goes through. So the junction between the medulla oblongata and the spinal cord itself goes through there. The cranial nerve 11, the accessory component of the spinal accessory nerve, goes through there. V2, the vertebral arteries go through there. 1 anterior spinal artery, 2 posterior spinal arteries, a sympathetic plexus. There's actually more stuff, because I think 9, 10, and 11 also go through there. Do they? I can't remember if it was the jugular, but for sure these are the big ones here. I'll have to check that. 9, 10, and 11. I think maybe that's the jugular foramen. Anyway, we'll just stay with the slides here. What do vertebral arteries supply? Always good board questions. If you've had a little bit of central nervous system before, this of course is the brain stem. There's the spinal cord. Where the spinal cord meets the medulla, that's the level of the foramen magnum there. Brain stem is made up of a midbrain, a pons, and a medulla. That's an easy question, right? When there's 3 different things, that's a perfect easy question for me to write. Which one of the following is not a member of the brainstem? Let's see, what else do they supply? So definitely the brainstem, the upper spinal cord, the cerebellum, and the posterior cerebral hemispheres can be variable. And here's just another picture of the vertebral artery going up. Remember, when it comes out of the C2 transverse foramen, it gets a name change, and that becomes V3 at that point. See it going into the, well, it's not really the dura, but once it goes into the dura, it becomes V4. Okay, I think we covered all that. And we already said how it's strange that the vertebral veins enter at C7, yet the vertebral artery enters the spine at C6, enters the transverse foramen at C6. Here are the 4 parts. I already told you these, so everything I just said, you can review that. And here's yet another picture. I think that's the same picture. Right, and here's just a close-up of this anatomy, how it goes through the dura mater. We're going to look at this dura mater today. But it is an interthecal, meaning it's inside the thecal sac. It's an interthecal structure. And the author completely screwed this up because this should go in right here. And it should be this should all be covered by the membrane. So that's a terrible picture, because we're going to look at the groove for the vertebral artery in lab today, and that's where it travels. There we go. Is that better? Yeah, that looks a lot better. See how it comes out, and then it penetrates this. It looks like ligamentum flavum, but it's not. It's called the posterior atlanto, meaning atlas, occipital, meaning occiput, so it runs between the atlas and occiput. And it's really too thin to be a ligament, so they call it a membrane. So that's the posterior atlanto-occipital membrane. It's clinically really important. I'm going to get off my slides for a second. In humans, we have a really strange thing that happens. This part of the posterior atlanto-occipital membrane, it likes to turn into bone. It likes to calcify. And sometimes it goes all the way up. And that has a special name, and you're going to run into that quite a bit. You'll see that on your patients. It's called a posterior ponticle. A posterior ponticle. And there is some not super strong evidence, but there is some evidence that it increases the risk for stroke in patients. When I was in school back in the day, we weren't allowed to adjust grade 5s on, like grade 5 manipulation is a crack, because you don't have to get a crack all the time. You can do lesser grade manipulations, but we weren't allowed to do that in our clinic because of the increased chance for stroke. But I think it's probably pretty safe. And nowadays we don't worry about it too much, but we'll look at some of the research. Might be associated with migraine headaches, but okay, the vertebral artery has some branches we should talk about, and these are all V4. I could have added in here. These are branches from V4. So it branches into meningeal artery, 2 of these, anterior spinal artery. So let's see what we're talking about here. So here's the vertebral artery, and now we're in interthecally. So this is V4. There's a thecal sac would be right here. So we have this meningeal artery coming off first. Then we have a bigger branch coming off here. That's the posterior inferior cerebellar artery. And then off of just the very end of the vertebral artery, there's a little wishbone right here that makes up the anterior spinal artery. Right, posterior spinal artery arises from the posterior inferior cerebellar artery. All right, so everything I just said, posterior inferior cerebellar supplies the, well, cerebellum and the medulla, and has that posterior spinal artery, as I said, coming off it. Just what you wanted to learn, more blood vessels, right? Thought you could escape blood vessels. You can't escape blood vessels. Another important concept, and you'll study this in Gross Anatomy 2 next quarter, but there's 2 types of meningeal layers in the skull. There's one that sticks to the bone, and there's another that kind of partitions up the brain into sections. So this is the second part of dura and meningeal layers. So these are called the dural partitions of the skull. And these are part of the meningeal dura, because there's a meningeal dura, an arachnoid, and then there's also this part, meningeal dura. And this is the one that partitions the brain into different sections. So you'll see these next quarter, but you have the falx cerebri. It's like a gigantic shark fin right here, separates the right and left hemispheres. Then you have the cerebellum is underneath this tent thing, so it would be right underneath here, and therefore it's called the tentorium cerebelli. Okay, so that one's more of in a transverse plane. There's one that you can't see, kind of a continuation of this shark fin that goes down like this. It's still in the sagittal plane, but it separates the right and left hemispheres of the cerebellum. So that is called the falx cerebelli. So we have the falx cerebri is this one. They get confused all the time. Hope I didn't get confused already. But cerebellum is the shark fin that separates the right and left hemispheres apart. Okay, so the word falx means it's going to separate right and left. So falx cerebri separates the right and left hemispheres of the brain. Falx cerebelli separates the right and left hemispheres of the cerebellum. There's another little one that sits over where the pituitary lives in the sella turcica, and it's circular and it has a hole in the middle of it. That's called the diaphragmatic sellae. Diaphragmatic sellae. So these are the dural partitions of the skull right here. So another one that's really easy for me to make a question of. They kind of look like an airplane in a way, where the tentorium cerebelli stick out horizontally, And then vertically you have the falx cerebelli, that's the big one. And then if it had another fin down here, which planes usually don't have this, that would be the tentorium cerebelli. Or I'm sorry, that's the other tentorium cerebelli. There's the falx cerebelli right there. I don't know if that helps at all. The other thing this will save you a lab next quarter. The other thing that's important, between the meeting place of all these sheets of dura, you have blood vessels. And these are the major highways that drain the blood out of the vein, or drain the blood out of the head. The giant one, the biggest one here, is called the superior sagittal sinus, which drains most of the blood from your cerebellum, the superior portion of the cerebellum, and it drains it into this. I used to call this the party house when I taught this. It's a confluence. A confluence is like a huge party house where you have buses of party goers coming from all different directions. There's a occipital route, but all this blood is dumped into this gigantic confluence, and this is where the party is. Party's in the confluence of sinuses. And then after the party's over, party goers have to get home, and so there's two giant pipes here called the transverse sinuses that leave the confluence of sinuses. And they go through, they take the blood basically back to the internal jugular vein, whereas all this venous blood from the head ultimately dumps into the internal jugular vein, into a structure called the bulb of the internal jugular vein. And so there's a kind of a twisty S shape, and you can see for the sigmoid sinus there's a groove dug right in the skull. You can see, same for the transverse sinus, you can see grooves dug in the skull for these exit the party routes. Okay, there's another one here, the inferior sagittal sinus. There's the falx cerebelli, or cerebri right here. Goes all the way up in here into the crista galli. And yeah, so at the top where the falx cerebelli connects with the skull dura, that's where the superior sagittal sinus is. Where it connects, this doesn't actually connect to anything. This is just a little passageway in the bottom of the falx cerebri. And that's called the inferior sagittal sinus. That dumps into another sinus that is made by the meeting of the falx cerebri and the tentorium cerebri. The falx cerebri and the tentorium cerebelli. And that's called the straight sinus, and that also drains into the party house here, confluence of sinuses. So listen to that again. I know that's always confusing. Okay, let's see. We've covered this, I think, already, but the basilar artery is here. So that's where the vertebral arteries kind of come together and form the basilar artery. Basilar artery dumps into the Circle of Willis, which you have to know if you haven't heard of that yet, and we'll go over that. Basilar artery is a single artery. There's not doubles of this one usually. And it's created by two vertebral arteries coming together at the level of the pons and the medulla. And specifically, you could say the basilar artery is born at the pons, so there's ponto, and medulla, there's medullary. So the ponto-medullary junction is where the basilar artery is formed by the vertebral arteries. It's got some important branches. We'll go through these right now in a second. At the level of the dorsum cellae, it ends by splitting into a right and left posterior cerebral artery. And we'll look at that here in a second. It gives off some branches to supply the pons. Let's just look at the thing. So here's the vertebral arteries coming together. Right at the junction of the pons and the medulla is where this occurs. It's a very big, powerful vessel here. It's got all these little ones coming off that feed the pons, give the pons blood. And what else do we want to say? There's an anterior-inferior cerebellar artery right here, which also supplies the cerebellum. There's an anterior spinal artery, but that was formed normally by the vertebral arteries, not the basilar artery. And just almost at the end, like if you're blood, you're going this way. So almost at the end of the artery, you have the superior cerebellar arteries, which also go to the top part of the cerebellum. Then the basilar artery splits into these two pieces, and these are the posterior cerebral arteries, and they go feed the kind of underneath part of the brain, the main part of the brain. But they do form the Circle of Willis. Here's the Circle of Willis. And so let's look at the Circle of Willis. So it's formed by the basilar artery, most authors say, and it splits into a posterior cerebellar artery. And then the posterior cerebellar artery gives off this posterior communicating branch, which plugs into the internal carotid artery. This is actually the end of the internal carotid artery right here. And this is middle cerebellar artery right here. So the internal carotid artery is part of the Circle of Willis. Then you have an anterior, see it right there? There's an anterior cerebellar artery, also part of the Circle of Willis. Right? And then it gives a cross branch right here. So that's called the anterior communicating artery. So super high board yields, you got to know the members of the Circle of Willis. Might as well get them done right now. They're very clinically important though, because this is the optic chiasma. This is where your tracks that make your eyes allow for vision to occur right here. It's where vision crosses over. And you can see that part of the Circle of Willis here is right against that. In fifth quarter, we'll talk about tumors that can occur right here and compress this part of the optic chiasma, and you lose your nasal field vision, but not your temporal field vision. So you just get a weird blind spot in the middle of the same side eye. We'll also talk about aneurysms that occur in the posterior communicating artery right here, and they can compress this nerve. And you'll learn this nerve a lot next quarter, called the oculomotor nerve. And that allows most of the muscles, not all of the muscles of your eyes, but most of the muscles of your eyes to move around. Like if you look up toward the ceiling right now, that nerve is firing. If you make your right eye go toward your nose, that muscle's firing. And so that can give specific signs. At the last quarter I taught those, but I was getting too crazy. You'll get that as you go, and I will get you in fifth quarter on that again. The specific deficits, like you'll learn the direct and indirect light reflexes, the pupillary reflexes, how to flick like you see it on TV where they flash the light in your eye. Why did they do that? We'll learn all about. You'll learn by the time you come to me. You'll already know a lot of that stuff. So the branches off the basilar artery, we have the anterior inferior cerebellar artery. That supplies the inferior cerebellar surface. We already looked at that. Superior cerebellar artery, that supplies the superior part of the cerebellum. And the pontine artery supply the pons. Circle of Willis, I've already talked about that. Who makes the Circle of Willis? Well, it's basically the vertebral artery system, because those converge to form the basilar artery, but they call it the vertebral artery system, and the internal carotid. Sometimes they call this the Vertebrobasilar system, but these are the two systems that make the super important Circle of Willis. Why do we care about that stupid Circle of Willis anyway? Why do we have to memorize that? The number one place for a stroke to occur, secondary to an aneurysm that ruptures, and the number one spot for an aneurysm to occur in your noodle is the Circle of Willis. And so if you get a bleed from one of those vessels popping, you get a subarachnoid hemorrhage, which causes a reflex spasm of muscles anywhere the blood touches. Blood vessels hate to be touched by blood. The tunica externa hates to be touched, and it causes a reflex spasm of the blood vessels to pinch shut. So even if you pop a little vessel in your brain, if the blood leaks into the subarachnoid space, that blood can touch other blood vessels and cause them to go into spasm. So you can lose a big piece of your noodle by a subarachnoid hemorrhage. There's the members of the Circle of Willis we've went through again. Let's look at them one more time. So there's the basilar artery. Here's the optic chiasma. So the Circle of Willis kind of surrounds the optic chiasma. These are the optic nerves, which are cranial nerve 2. And you'll have to learn all those. You can start learning those. If you don't know those nerves, you're going to need to know those like backwards and frontwards. But again, posterior cerebral arteries piece, then that gives off a posterior communicating. The internal carotid is just a little piece of the Circle of Willis, but there it is. That gives off an anterior communicating, or an anterior cerebellar artery in blue, and a anterior communicating communicates between the two anterior cerebellar arteries, and then it repeats on the other side. Okay, why do we care? Those aneurysms that occur in the Circle of Willis have a special name. They are called berry aneurysms because the early anatomists and pathologists thought they looked like little red berries, little holly berries, but couldn't find a good holly berry, so I just threw a blueberry in there. Why else do we care about them? As I said, they can compress the optic nerve at the optic chiasma. They can compress the oculomotor nerve, and you can get dysfunction of these nerves. Anytime you have an injury to a cranial nerve, the condition is called a palsy, like Bell's palsy. You've probably heard of this problem with cranial nerve 7. But you get a palsy from this. Here's a cartoon of the internal carotid artery, an aneurysm. It hasn't ruptured, but it's grown in size and it's irritating these tracts here. So these patients have a nasal field visual disturbance on the same side as the lesion. And here's the posterior communicating branch. Shows an aneurysm, berry aneurysm right here. It hasn't ruptured, but see how it pushes into the nerve here? There's cranial nerve 3 that runs right adjacent to it. So you get problems with accommodation reflex, the fields of gaze, and the pupillary light reflex all get messed up because of that. Okay, back to some general anatomy. We're never going to get through. Are we going to get through these? We might get through these. So what makes up the neural foramen of 2 cervical vertebrae? It's a little bit more complicated than the lumbar spine because the neural foramen, remember those are the holes where the motor and sensory nerve root leave the spine. They actually point forward about 45 degrees. The ones in the thoracic and lumbar spine, they come out perfectly straight, just lateral. In fact, when you take an x-ray, the right and the left neural foramen are superimposed upon one another. Not true of the cervical spine. You can take an x-ray of the right IVF and the left IVFs. Why? Because they come out at 45-degree angle, which is, I don't know if that's weird, but it makes it really easy to take x-rays of it, though. So what are the boundaries? This is a tough question because authors say different things about this. Let's actually go look at them. And let's see. Here's an overhead view. So here's the IVF would be right here. But let's look at a side view and see what we can see. So this is kind of an oblique shot of 2 bones that are down in the lab. And it's not perfectly lateral. If it's perfectly lateral, you can't really see this hole that good. So it is at about a kind of a oblique angle. But we can see the IVF here. And let's see what makes up the boundaries. Well, the superior articular process of the inferior member of the motion segment, that's C5 and this is C6. So the superior articular process of C6 and the inferior articular process of the bone above the top member of the motion segment, C5 in this case, make up basically the posterior corner. And so does the facet joint is right in here as well. But now you can see if you get a bone spur growing off superior articular process, see if we get a spur like that, it could stab the nerve coming out of there. Okay, the roof and the floor are made up of pedicles. Specifically, here is the superior notch, vertebral notch, right, because of C6 makes up the floor. That was on your test, right? Some of you guys didn't do so good on that. Remember, the superior vertebral notch comes off the superior part of the vertebrae, but it makes up the kind of the bottom part of the hole, or the floor, or the inferior part of the IVF. The other one, the superior notch is much smaller, and it's actually being blocked by this transverse process. We'd have to cut that away, but it would be right there. So that's made up. So the roof and floor are basically made up of pedicles. If you want to get a little deeper question, they're made up of vertebral notches. Now the anterior part is a little more difficult. Mostly it's this Batman's ear right here. This is called the uncinate process. So that's what makes up the border. A little bit of the vertebral body does as well. The superior vertebral body makes up this part right here, so that's a member of the anterior part of the foramen as well. Right, so that's the story with that. Here's just another look here. You can see the uncinate processes again on this real bone. There's the superior articular process of, if that's C5, that's C6, that's 6 here. Right. Another important concept, this is always a great board question, not for your class, but what are we looking at here? Remember I said you can see individual holes? When I see that R right there, see how it's behind the spine? You can see the teeth right here. There's some wisdom teeth. So this is the front, this is the back. There's the mastoid process right here. So when I see a R behind or posterior to the spine, it means that this is a posterior oblique view. There's an anterior obliques and posterior obliques. They're going to drive you crazy. But just remember, when the R is behind the cervical spine, that is a posterior oblique, specifically a right posterior oblique. And here's the confusing thing. A right posterior oblique means you face, and if everybody's watched that video on my introduction to radiology, if you twist yourself counterclockwise with the right shoulder and the right trunk touching the bucky, so you're not straight, you're kind of twisted, and you shoot a x-ray beam through your neck, you're actually looking at the left intervertebral foramen. So if this is a right, well, we know this is a right posterior oblique. The right posterior oblique shows the opposite side neural foramen. Okay? And the anterior oblique is the opposite of that. But I'm not going to go crazy on that. So the bucky's here, so the skeleton is kind of placed obliquely with his right shoulder against the bucky, maybe a 30-degree angle over here. So this shoulder's not touching the bucky at all. And we shot the x-ray, you can see how the right side is touching the bucky, but the left holes are come into view, if that makes sense. Okay, the other concept, I think you know this, Bo, but a C5, let's go back to this one. So C5, C6, here's a really easy board question, you can't miss this. First of all, who is this disc? How do I name this disc? Okay, let's see who the champ is today. Put down in the comments what disc that is. Is it C4, C5, C6, or C7? Well, remember the rule. This rule applies to the entire spine. Whatever bone sits on the disc conquers the disc. So this is the C5 disc. Right? Now, what nerve root is this? The nerve root belongs to the bottom member of the motion segment. So if that's the C5 disc, this is actually the C6 nerve root right here. Okay, so make sure you know that. That's really good. And how many roots, how many spinal nerves are there in the cervical spine? How many bones are there? C7, how many nerves are there? There's actually 8. Right? 2 of them come out between atlas, and that's what, we'll look at that in class, but that's where things get messed up. The rest of the spine is normal. If this was L5, this would be the L5 exiting nerve root. If that was T5, that would be the T5 exiting roots, or spinal nerve, whatever you want to say there. So make sure you know that stuff. Right. Okay. Also remember that this nerve root, this is the exiting nerve root here. A little different. I'll show you a model in lab. It makes it look really nice. But there's really a motor and sensory root. But they come together to form a spinal nerve. And that's the spinal nerve. The spinal nerve is formed by a sensory nerve and a motor nerve that come together. And there's a dorsal root ganglia here that's not drawn. All right, but this spinal nerve, they're fused into one. So this is a mixed nerve. And that splits into, I think we said this already today, that's a dorsal ramus and that's the ventral ramus. Okay, just another kind of oblique view showing if this is C5, that's the C6 exiting nerve. That's actually the spinal nerve in this cartoon. And that's the C6 ventral ramus. Dorsal ramus splits into at least a medial branch and a lateral branch. Sometimes we even have an intermediate branch coming off between these two. All right, we did it.